Personal finance made insanely simple for doctors.
Hi everybody, I'm Josh Lumbley. I'm a board certified anesthesiologist, and I am also Chief Quality Officer of a large anesthesia group practice. And I'm part of the leadership team here at Doc. I'm joined today with Dr. Zwade Marshall, who's not just a practicing physician, but he's also the CEO of Doc. Zwade, great to see you.
Josh, it's a pleasure to be here with you. And we got to say that I tell the crowd that Josh and I trained together at Harvard. He was chief resident a few years before me, and his name rung out as a true leader at Harvard Brigham and Women's. And I'm just thrilled to be in this journey with you, Josh, and to work with you now in Doc.
Too kind. Appreciate that. So Zwade, as doctors, we are trained to be ready for anything with our patients. We prepare for emergencies, we anticipate complications, and as anesthesiologists specifically, we step up when things go sideways in the operating room. But we are also really big on preventing emergencies in the first place.
It's interesting, Josh, how preventative care can make such a difference. Yet so many people see it as a luxury. They don't make that connection between daily choices and long-term consequences, and it ultimately hurts them.
It does. And that same analogy applies to finance exactly the same way. Healthy daily habits put us in a better position to be able to handle life's curveballs. So when it comes to financial emergencies, it really boils down to two things: your insurance and your emergency fund. So let's kick off a conversation about those two things and start with insurance.
When I started residency many years ago now, I was given the option of four types of insurance. They included health insurance, disability insurance, life insurance, and malpractice insurance.
Yeah, and those four biggies really impact your personal finances. So let's break them down. We'll start with the one that is really important if you're going to be practicing medicine, and that is malpractice insurance. So malpractice insurance is basically like a shield that kind of protects you and covers you if you ever face a lawsuit for medical negligence or a medical error. And it is a must for practicing physicians. And the specifics vary a lot based on state, your specialty, as well as your employer. And really, most of your hospital employers or your private practice employers are going to require both malpractice insurance, but they're also going to be the ones that provide it.
And I know that many folks may think, what is the probability of them needing malpractice insurance these days? And the AMA has published a study back in 2016 that found that 34% of surveyed physicians have been sued in their careers. The reduced use of regular medical services during COVID is considered a large reason that this number dropped to 31.2% in 2022. So the risk of malpractice claim varies based on specialty, career length, and gender. It makes sense that the longer your career is, the more likely you are to have been sued. And almost half of all physicians, that's 46.8% to be exact, over the age of 55, had faced a malpractice claim in their career. So almost half of all physicians have faced a malpractice suit. And I imagine that surgeons have the highest probability. Is that true?
Well, that is correct. As a matter of fact, it is surgeons as well as obstetrics and gynecology. Those are the two specialties that are most likely to get hit with malpractice claim. But there is a silver lining to this, and that is most of these lawsuits don't end with proof of medical error. So between 2016 and 2018, 65% of the claims of malpractice were dropped, dismissed, or withdrawn, and only 6% of those went to trial. And those that went to trial, 90% of them were won by the defendant. Having said all of that, there's a lot of emotional and mental stress associated with them, and there is the medical expense that is associated with a claim that is found in favor of the plaintiff.
It's comforting to know that despite being sued under malpractice claims, that physicians tend to come out victorious so often in those claims. And so, but I can imagine that emotional toll can be really costly. Now, if malpractice claims were lower when there were lower demand for services during COVID, I wonder if claims will increase when there's higher demand. What do you think?
It's a great point, Zwade. When you look at the U.S. facing a shortage of 100,000 physicians by 2030, as well as the challenges around an aging population, there is the possibility that we may see an increase or a spike in claims. It's certainly something to keep an eye on.
Clearly, I think you've made the point that malpractice insurance is worth it. We should also discuss other types of insurance, starting with health insurance. A
Yeah.
single resident will most likely have basic coverage, right?
Yes, that is correct. They'll have basic coverage. And even if you are single and healthy, it really is important to understand health insurance beyond basic coverage. It's not just about covering your hospital stays or an emergency event. It's about getting your medications as well as preventive care at a lower cost. So most of your insurance, your health insurance, is going to have a narrow network, meaning a set group of providers that you're eligible to visit who've agreed to lower rates. Your options might be a little bit limited. Having said that, your coverage costs are going to be a lot lower.
Coverage costs, health insurance, the bane of most of my patients. They always complain about premiums and deductibles. What are those costs? It's important that folks remember that there are premiums, which are your monthly subscription costs. There are deductibles, which is how much you pay before insurance starts to cover your costs. And then there are out-of-pocket maximums, which is the most you'll pay yourself in any given year. What can doctors do to minimize these costs?
When you're young and healthy, early in your career to mid-career, you can save a lot of money by choosing a low premium plan with a higher out-of-pocket cost. What that means is that your deductible is going to be a lot higher. And along with that, you're going to have to make sure you've got some savings in the tank to cover potential expenses.
Is there anything else that doctors can do?
Yes. Now, it's hard. You're busy as a resident and a junior attending. You're taking care of patients. You've got long hours, but it really is important that you take care of yourself, whether that is taking care of your mental health, but certainly also taking care of your physical health. The earlier that you catch and you treat health issues or that you prevent health issues from even occurring, the less it's going to cost you in the long term, physically and financially.
So skipping that annual exam isn't worth it, especially because most preventative care is free. So just make sure you carve out the time for it, even when you're busy. Most insurance is about managing risk, and that is especially true for the next type of insurance, disability insurance. I signed up for disability insurance, but really, what's the probability that I'll need it? What do you think?
You might think that it's really low and that folks needing to take advantage of disability insurance is exquisitely unlikely. The reality is, according to the AMA, there's a 20 to 30% chance that you will file a long-term disability claim at some point in your career.
30%. Wow, that's extraordinarily high in my mind. But I can imagine that part of this is attributed to the nature of the work, since it can be physical and high stress. The other reason is that a physical disability may actually prevent a physician from working, which would not affect someone the same if there were another career, like marketing, for example. So this all seems to make sense the way you're describing it, Josh. But it would be devastating for a surgeon to train so many years and then lose that hand function, for example.
Yeah, it doesn't mean that that individual's career is over, but what it does mean is there's going to be a big shift in the capacity to perform those surgeries and a significant hit to your income.
Hmm.
Being out of commission for longer than expected can, of course, mean lost income. And that's why disability insurance is so valuable.
Hopefully, I won't need it. I sleep better knowing that I have it. But that 30% incidence is a compelling number. Thank you for that. What do you think about life insurance? You'll say that there's 100% chance that I'm mortal, right?
Yeah, we're in the same boat here, Zwade. Life insurance is more about protecting the people you leave behind. So it really gets more important once you've started a family. And with life insurance, there are two big classes there. There's term life insurance and there's whole life insurance. So for term life insurance, you choose a set time period for coverage. So maybe 10 years, 20 years, 30 years, and it only pays out if you pass away during that time period. So since it is limited for that 10, 20, 30-year time period, your premiums are going to be cheaper. On the other hand, you've got whole life insurance, and that covers your life and includes a saving component that builds over time. So because of that, it is a little bit more expensive. So those premiums are going to be higher.
Whole life insurance seems like potentially a pretty good investment. And I understand that with all investments, we need to look at both the cost and the annual return that you'll get. Whole life insurance, the cost benefit analysis is not as linear as other investments may be. And so I think anyone considering this option should speak very closely with their insurance advisor.
So yeah, Zwade. So for most doctors, term life insurance does the job and has more affordable premiums.
So is there a suggested amount for life insurance coverage?
It varies, but in general, your coverage should be enough to cover both your family as well as any debts you might leave behind. So now let's shift, Zwade, and let's talk about the most important thing you can do to prevent future emergencies, and that is your emergency fund.
So Josh, you just asked me to pay premiums for malpractice insurance, for health insurance, for disability insurance, and life insurance. I know for a fact I have no money left.
I hear you, Zwade, and I completely understand. But ironically, because of all of that, that's exactly why you need to save for an emergency fund.
So what's this emergency fund that you're referring to?
It's basically a savings account you keep just for unexpected expenses.
And isn't that what insurance is for?
So let's put it this way. If insurance companies lost money every year, would they still be around?
I guess not. So you're saying that insurance company calculate their premiums to cost more than what the emergencies are expected to cost.
Exactly. So insurance companies offer value like group pricing negotiation, but they also charge you to save your own money for emergencies.
So you're saying an emergency fund is kind of like managing my own insurance company. I use my own savings if I have a cost.
That's exactly right. So, Zwade, my second year, the starter on our car went out. And thankfully, we had an emergency fund to take care of that car repair. So, a car repair, sudden income loss, medical emergency. Maybe you have an animal that needs to go to the vet for emergency surgery. The more you have in your emergency fund, the less you have to rely on insurance or expensive loans to help cover that financial burden.
That's a really good point, Josh. And when I was in residency, I had a flood in my apartment. I needed to cover the cost because I didn't have fully comprehensive renter's flood insurance. I'll say too, though, that with the emergency fund, it's more about the habit of putting some money aside on a regular routine basis than how much you put aside. So just the habit of investing, of saving, of ensuring you're thoughtful about what kind of funds you have in your savings is going to pay long-term dividends over the course of your career. So how much do I need to pay myself for an emergency fund? What do you think is a reasonable amount to put aside?
Yeah, it's a great question. And in general, you should have somewhere between 3 to 6 months of your salary saved up in your emergency fund.
Mental note, don't have any emergencies in the course of the next 5 years.
It's tough pulling those funds aside and putting them in an emergency fund. But again, just like you said, it's all about setting good financial habits. So start where you can.
Now, as you mentioned your car starter, you just pointed out another type of insurance that's possible, and that's auto insurance.
Exactly. And auto insurance can eat your lunch. It is really expensive, which is why during residency, we only had one car and I rode my bike to the hospital every day.
No wonder you're so svelte and fit. If I bike to work, I would need that life insurance because I'll be in the middle of traffic in Atlanta here.
We didn't cover retirement savings, but that's another area to start small and build up. Budget to save a bit from every paycheck just to get in that good financial habit. So put some money into your emergency fund until you've got the 3 to 6 months of your salary saved up in there.
I think this has given our audience so much food for thought. Thanks, Josh. I'll tell folks, don't just think about it, act on it while it's still fresh in your mind. This is a good time to create a vision board for what your personal finances will look like in 10 years and how you'll get there. Doc to Doc has a template for this, plus a budget template and other tools at doctodoclending.com/learn. We want you to master your personal finances, so take the test at our website to get a reward too. Thank you.
All right. I think we hit it.
You got it.
Yeah, my pleasure. I love doing this with Zwade.